So question one, what does healthcare look like in Canada?
5, 4, 3, 2, 1.
Right now we're seeing three shifts in the healthcare system. There's a lot of talk about the financial sustainability of the system, and so we're seeing a lot of conversations happening between the provinces, federations, and other organizations about how we can maintain this. The second trend is the aging demographics that we have in Canada, and that we know that as people age, they actually are tapping into more expensive healthcare options, which is where we're also seeing the third shift, which is talk of going towards more patient-centered care instead of doctor-centered, if we could say it that way.
I think there's been no question that over the past couple of years, we've seen significant changes to drug pricing reform in Canada. So the fact that rebates are being eliminated, the fact that generic prices are dropping, is no question having a negative impact on the bottom lines of pharmacies.
In many ways, it's all about finances. And so as long as pharmacy can position itself as the deliverer of the same or maybe even better services for less, I'll tell you, they will continue to have a role in the continuum of healthcare that in fact might be an expansion of its current services.
With the ability to prescribe, I think they're going to have a much more active role, as I mentioned before, in the actual healthcare delivery and really be able to look at the whole spectrum of a patient's needs. The innovation that pharmacists bring and the opportunity for them to look at the patient from a much more holistic perspective is going to be important.
I think it's really important that the pharmacists are looking to optimize their role. And the only way they're going to actually optimize their role is to make sure that their entire team around them is optimized. Pharmacists then need to take on some of this accountability, need to work within an interprofessional team and link themselves into either family health teams, GP offices, prescribers. Some of the other innovations that we're going to have to look at is we're going to have to look at automation and maximizing the use of the pharmacy technician. Obviously, this clinical role, this monitoring role is going to take time, and we need to free up the pharmacist's time by optimizing the role of the pharmacy technician, giving them greater accountability for the distribution processes, as well as using technology to make the processes much more effective and efficient.
As we evolve the business model of pharmacy away from what it was and has been for so many years, we're going to be entering some uncharted territory from a business perspective. And so pharmacists are going to need to be able to deal with that. They're going to need to be able to adapt to that notion of taking risk in order to survive and in order to thrive. They're going to need to be open to new ideas and new challenges. However, I think for independents, there is an opportunity if they're willing to customize their services, if they're willing to create niche markets for themselves.
But I think a key factor in all of this is to make sure you understand fundamental business associated with healthcare delivery. And I think that for pharmacy to seize upon this, I believe personally that what they need to do is have a very, very concerted idea about how to position a service. We can do it for this price, but we can also do add-ons for that. And the person is suddenly realizing, wait a minute, it's like one-stop shopping.
I made this transition from being a scientist into what I am today because I transitioned using different skills such as leadership skills, relationship skills, and business skills. Those are the three things you need.
On the business front, to understand everything from kind of systems business through planning business, through finance business. These are the key parts to understanding how to market your services. If you don't understand the basics, then you may not appreciate what you can do on the marketing side to make sure that you have an advantage. That means marketing 101.
Well, I think one of the things that we as individuals and as a profession of pharmacy continue to need to develop is leadership skills. Management skills are also important. So management skills are the ability to make sure that the operations that we're part of are running smoothly. Day to day, we're doing the things that we need to do to make sure that we are delivering our promise to our patients.
There will need to be more of an entrepreneurial spirit. With the elimination of rebates, with the lower generic drug pricing, the fact is that there will need to be greater specialization. There'll need to be more of a business lens through which they see how they do things.